Oh, this new medication has been just wonderful for him in his life. He's now at the point where he's not worrying or stressing out about getting a headache or having to miss any activities. So that as a parent is so great to see too, because you hate to see your child in pain or having to miss things that he loves and enjoys doing. So finding an effective preventative medication to help with these migraines and keep them at such a small amount of occurrences during a month has just been wonderful. So we are so very happy and thankful with the results that my son has seen so far with this medication.
And then knowing that, you have healthcare providers there to help you investigate this, your primary care provider, the pediatrician, there's headache specialists, there's pediatric neurologists there along the way to support you through that. And that includes listening to the patient, helping them be their advocate, helping them find treatment options that are helpful for them, and maybe considering Ajovy as a treatment option for preventative migraine treatment with patients with episodic migraine.
Hey everyone, this is Jonathan Marx from GoToHealth. I hope you're having a wonderful day. Today's show is about a topic that affects a lot of people, and you'll see what I mean in just a second. Migraine is one of the most common neurologic conditions affecting millions across the U.S. and more than 1 billion people worldwide, including children and adolescents. Nearly half of migraine cases are hereditary, and the condition can take a real toll on school, sports, and family life. For parents and caregivers, it often means years of worry with limited treatment options to help. With the FDA's recent expanded approval, Ajovy, that's AJOVY, is now available as a preventive treatment for children and adolescents from ages 6 to 17. Approved for adults since 2018, it's now the first preventive therapy targeting the CGRP pathway for children and adults, addressing a critical gap in care. With us to talk about this new drug and its effect on kids is Dr. Jennifer McVige. She's a neurologist who specializes in adult headache and concussion, pediatric neurology, and neuroimaging. Dr. McVige is board certified in psychiatry and neurology, pediatric neurology, adult and pediatric headache medicine, and neuroimaging. She's the director of the concussion clinic at DENT Neurologic Institute, the Concussion Connection Support Group, and is currently on the board of directors for the American Society of Neuroimaging. Our other guest is Lindsay Mang. She's the mother of a teenage son living with migraine. Between the ages of 8 and 10, her son began to experience frequent headaches, which over time progressed into debilitating migraines. Having also lived with migraine since childhood, Lindsay understood the serious impact it can have on her son's life. And since starting treatment on Ajovy, Lindsay has seen a meaningful improvement, and her son's migraines have become less frequent. Before we get to our guests, a reminder, please, if you're enjoying our show, please give us a thumbs up or a 5-star review on YouTube, Apple, or Spotify, or wherever you're listening to us. It really helps us get the word out to more people. Thanks in advance. So welcome to the show, Dr. McVige and Lindsay. How are you each today?
Wonderful. Thank you for having us.
Great. Thank you for having us.
Good. It's my pleasure. So Dr. McVige, how common is migraine in children and adolescents, and what should parents watch out for?
That's a great question. This is an undertreated and underrecognized disease state in our pediatric population. It occurs in 1 in 10 children, which is quite significant. So, and it's not as uncommon as people believe. In a child, they may not be able to verbalize exactly what they're feeling and exactly what their pain feels like the same way that an adult does, but they still experience all of that the same way.
Sure.
Kids may present with light sensitivity or sound sensitivity, which might be avoiding things. So they'll go to their room and want to be in a dark room, be away from the family. They may have like a throbbing sensation, but they may describe it differently. They may have nausea, but not be able to say that word. They could have vomiting, but you don't have to have vomiting to have a migraine. And usually it will get up to a moderate to severe intensity, which would cause them to not be able to do certain activities or want to sit and rest out. And even if they do the activity, they may not be present the same way. So, like when someone has a migraine, they may be able to sit there, but they may not be intellectually able to absorb the information the same way or emotionally be able to have that same conversation because they're struggling with the pain that is intense and taking some of their emotional and physical energy away.
Wow, that's a lot for a kid to deal with. Dr. McVige, is this hereditary in any way, or is there a predictor for what kids will get migraines? I mean, 10% is a large percentage of the population.
There is a hereditary component, we believe. As of right now, we know that there might be a 42% of people that have a genetic inheritance, but there's also something called a stress diathesis model where we believe there's some genetic inheritance and some environmental factors as well. So people don't always have to have that genetic inheritance, but frequently I find myself treating, the family. So the parent and the child and the siblings, and, it's hard.
Yeah. So, Lindsay, tell us your story. Your son has had migraines, and do you have a history yourself?
Yes, thank you for that question. I'm sharing my personal story on behalf of Teva. I myself do have migraine headaches, and I get them. So when my son was starting his journey, I did have a feeling that he too was not just having a bad headache and that he was suffering from migraines. So it was during his elementary school years where he started getting his headaches. But it ended up being his fourth grade year where we saw an increase in frequency and the severity of the headaches were getting worse. So we worked closely with our pediatrician and then got linked through our pediatrician to Dr. McVige's office. We've been seeing Dr. McVige and her team for years now, and we had discussed different possible triggers and symptoms and treatments along the way. And we had some preventative treatment options where, they helped. And at the time, that was great that it helped. And he was still getting those 6 to 10 headaches per month. So there were times where he was still missing school, or he'd have to miss his soccer game or social events. So when it came to Jovi being available and an option that we thought would be good for my son to try, we are pleasantly surprised and happy with the results that he has had. And now on average is having about 2 headaches per month, which is just amazing because he's now at a point where he's not having to think or stress about, like, am I going to get a headache today?
Yeah.
Am I going to have to miss soccer? Am I going to have to miss school? So we are very happy that this preventative treatment option has worked so well for our son.
Good. How old is he now?
He's 14 now.
Okay. And when did he start getting these headaches?
So yeah, it was during his fourth grade year where we then started to go see Dr. McVige and explore treatments that would be available for him on the preventative side, because the amount of headaches and the frequency of the headaches that he was getting per month was something that we wanted to work with her and her team with.
I really appreciate that you referred to this as a journey, because it really sounds like it has been for you, and a long one, huh?
Yes, absolutely.
Let me ask each of you, are there triggers, identifiable triggers that can bring headaches on that are avoidable, or that we can, the kids or the parents can be aware of to decrease the frequency of these headaches?
Yeah, so I can take that. So some of the things that we counsel families on is, typical migraine triggers can include stress, sleep irregularity, not having enough water. Smells can trigger smelly candles and things like that. MSG, which is monosodium glutamate, a preservative, nitrates, which is again a preservative, sometimes a large volume of cheese, caffeine, red dye. So the way that I explained it, it's a lot of the processed foods. So things in the environment, anything at a kid's birthday party nowadays probably is something you don't want to have.
Got it. And Lindsay, do you have predictors for your son for what will bring on those headaches?
Yeah, there are some things that we, have worked with, and, as having a young child, the sleep patterns are one thing that we try to stay on a good routine, because sleep is so important.
Sure.
Yeah, drinking water is another thing. He's very active. He plays a lot of sports. So like early on, asking him, did you drink enough water today at school? Or did you, those are a few things and areas that we would work on, sometimes weather related. So yeah, there's different areas and things that we definitely notice as parents and caregivers. And we just really always said to him, be your own advocate. And you have us as parents and caretakers as your own advocate. So if you're feeling signs or symptoms coming on, let us know about it, because sometimes, outwardly he would appear just fine, So we always just said, always make sure your voice any concerns or if you're not feeling well.
So you really said an important point there, which is teaching your child to be their own advocate, because they're really the ones that know what's going on inside their body.
Yeah. Right.
Good. So, doctor, tell us about this relatively new drug. It's called Ajovy. And if people want to learn more, they can go to ajovy.com. And let me spell that. It's AJOVY, AJOVY, ajovy.com. So, doctor, tell us about this new drug.
Yeah, so Ajovy had been FDA approved in the adult population, patients with migraine who are adults, since 2018. But thankfully, in August of this year, this is now approved for our pediatric population, which is children and adolescents who are aged 6 to 17 years old who have episodic migraine, which would be less than 15 headache days a month. And it is a preventative treatment. So, the nice part about this is we don't want to wait until we have a headache and then try to treat it. And there's something called chronification, that when people have too many headaches, that things can get worse. So we want to prevent. The goal is prevention. We just don't even want to have one, right? So the goal is to try to get these number of headache days down, and that's what this medicine was designed to help with. It is a disease-specific medication. So what is unique about this is that as a CGRP inhibitor or antagonist. So CGRP is Calcitonin Gene-Related Peptide. It's a big word for a neuropeptide in our brain that can be elevated when we struggle with migraine. And that is the thing that we believe is associated with, elevations of this is what we believe to be associated with creating the disease state of migraine. And so this is the first and only disease-specific medication for pediatric patients as of yet to prevent the headache in these patients.
Good. So my show is really focused on evidence-based medicine. And doctor, you just talked about the fact that this drug, Ajovy, was originally approved for adults, and then it's recently gotten approved for children. Well, just briefly give us the process for how that approval for children took place. Is it clinical trials? How does this work?
Yeah, so this is a double-blind placebo-controlled trial. It's called the SPACE trial if anyone wants to look it up, and that's just an acronym. But typically what happens is that when we have an approved medication now for adults for a certain disease state, they will go and look at the pediatric population. And so clearly, there is a distinct need in this pediatric population for migraine preventative treatment. So those studies were underway to look at a reduction in monthly migraine days and monthly headache days, and see if the medication could indeed be efficacious in this patient population. So, the trial was underway for several years, and as I said, it was double-blind placebo, and it is thankfully approved by the FDA at this point in time and reached all the primary and secondary endpoints.
Right. So double-blind placebo means neither the researcher nor the patient knows what treatment they're getting, and some people are getting the treatment, and some people are getting what would we call a placebo, right?
Correct, which would be nothing. It would be no treatment-based item. And so this is a once-a-month injection. And so the patients in the trial did receive, that were blinded. The researchers were blinded to what someone was receiving, and they were able to go through with this trial and then find that even if someone didn't know, it was statistically significant finding that the people that were taking the medication did improve.
Good. Lindsay, what has this new medication meant for your son and his life?
Oh, this new medication has been just wonderful for him and his life. He's now at the point where he's not worrying or stressing out about getting a headache or having to miss any activities. So that, as a parent, is so great to see too, because you hate to see your child in pain or having to miss things that he loves and enjoys doing. So finding an effective preventative medication to help with these migraines and keep them at such a small amount of occurrences during a month has just been wonderful. So we are so very happy and thankful with the results that my son has seen so far with this medication.
What a relief for both you and him. That's great. So let me ask the question that I always like to ask near the end of the interview. What question haven't I asked, or what big message would you like to leave people with today? And I'll give each of you a chance to answer that.
As a parent specifically, I would say, listen to your child and encourage them to be an advocate for themselves, and you yourself be an advocate as a caregiver. It is a journey. I did speak to it earlier. It's a process of learning to see what areas, what triggers, what things may help, what preventative treatments are offered and available. So I would say to, if anyone is in that type of situation with their child is to work closely with their pediatrician and their medical team to see what options may be best for their child. I'm just very thankful that this option is available for mine because it has been a journey throughout the years. And to now see him be in a place where he doesn't have to worry about headaches, it's just a great place to be.
Good. I'm so glad and happy for you. I know what I wanted to say, what a pain, but how difficult this situation must be and how much relief you must feel that this is kind of relieved in some way. Doctor, what kind of message would you like to leave people with today?
I think, children, you don't know what you don't know is one of my favorite quotes. And if you've always struggled with the pain or the pain's there, they don't know how to express it. Sometimes it's kind of like needing glasses and you didn't realize you needed glasses till someone put the glasses on and then you realize, oh, I can see clearer. So, sometimes the kids just aren't able to express the pain the same way. So as Lindsay had said, listening to your kid, listening to what they're saying, maybe they're not trying to get out of school or avoid school, really give them the benefit of doubt and understand and meet them at their level and say, well, what is the barrier here? What are you feeling? What's going on? If they're trying to tuck themselves away in their room all the time, maybe they don't feel good and they don't know why. And so getting at the root of that. And then knowing that, you have healthcare providers there to help you investigate this, your primary care provider, the pediatrician, there's headache specialists, there's pediatric neurologists there along the way to support you through that. And that includes listening to the patient, helping them be their advocate, helping them find treatment options that are helpful for them, and maybe considering a Jovi as a treatment option for preventative migraine treatment with patients with episodic migraine. And, always you can go to that website that you had cited previously at ajovi.com, which is AJOVY.com, to find out more information about migraine in general, or look at the studies if there's questions, and understand, episodic migraine in pediatrics and what might be available for a patient.
Good. And this is preventive medicine.
Correct. This is a preventative medication. So the goal in life is not to have migraines, but, we want to decrease the number of headache days that we can as much as we possibly can.
Thank you so much for both being with us today. Really appreciate it. And I'm going to do my best to get the word out about this.
Thank you so much.
Good.
Thank you.
So we've been talking with Dr. Jennifer McVige. She's a neurologist who specializes in adult headache, concussion, pediatric neurology, and neuroimaging. She's board certified in psychiatry and neurology and pediatric neurology, adult and pediatric headache medicine, and neuroimaging. She's the director of the concussion clinic at DENT Neurologic Institute, the Concussion Connection Support Group, and is currently on the board of directors for the American Society of Neuroimaging. We've also been talking with Lindsay Mang. She's the mother of a teenage son living with migraine. Between the ages of 8 and 10, her son began to experience frequent headaches, which over time progressed into debilitating migraines. She and her son have seen meaningful improvement with Ajovi, and her son's migraines have become less frequent. Thanks so much both for being with us today again.
Thank you for having us. Thank you.
Good. This has been Jonathan Marx with GoToHealth. And as we say at the end of every show, go to health. God bless. We'll see you again next time. Take care. Thank you for tuning in today to Go to Health. You are one of almost 10,000 people per day who enjoy the evidence-based health information offered by our guest health experts. You can watch us on our website and YouTube and listen to us on 8 podcast networks. Be sure to join Jonathan Marx in our upcoming shows each week. If you like our show, please share this episode with your friends and colleagues. You can subscribe to the show, join our email list, send us feedback, browse through the online store, and view our library of over 150 shows at GoToHealthMedia.com. See you next time, and remember to elevate your life with Go to Health.